to check in now and probably prioritize more time to make sure that we are able to address what's going on and be there for them. So some teams are wearing colors, which is great. So it may be a bracelet or something on their scrubs, but it's a way of everyone being able to work well with each other, maybe pick up the slack if someone's in red, know when to check in, and just be there for each other better. And we create that culture of everyone checking in. So those are at least some strategies I've seen that have worked.
I love those strategies. I love number one, normalizing it, right? This is just a part of onboarding. And I think that is definitely a big hurdle. I've engaged with EAP as well through the Alberta Vet Med Association. And yeah, there's a process you have to go through to open up your account. And I remember having issues like creating my account. It said this account exists with this email, and yet I couldn't log in. I wasn't getting a password reset. So do that during the onboarding. Make sure that that is ready to go because you're right. In the time of a crisis, nobody's going to be in their right mind to, be able to set up that account or even think about how to muddle through that. And the ability to visualize within your team where everybody is at in terms of their own reflection and disclosure and wearing the colors, the bracelets, the pin, whatever it might be. I love that. I love that strategy. So thank you so much, Amanda, for sharing those
You're welcome.
ideas.
You're welcome.
One of the things I wanted to say, to build on that, and Sophie, I want to invite your perspective here. Many veterinary professionals experience that self-stigma, right? Feeling guilty or weak for seeking help, that self-criticism, that self-judgment. I shouldn't need help. I should be able to get over this. Or, this is just a part of being a veterinarian. Why can't I just power through? I'm wondering if you can share your own experiences with that, because you and I have had similar experiences that way. And as help providers, especially, that can feel very unsettling. So, what did you experience, and how did you come to overcome that?
Sure. Thanks, Marie. And I guess the first thing I would probably want to say in this is that I don't think I necessarily have fully overcome that yet. I think that's definitely still a work in progress for me, and probably actually will be for the rest of my life. But actually, that's fine because I'm on a journey with that, and even just having this discussion that I think is part of my own personal journey. So thank you for having me here to share that. And again, I guess as part of that, I just want to say anything that I share is my personal experience, and I hope that that helps somebody else out there that might be feeling a similar way. But I also recognize that that's just how my journey has been and how I feel. So that's not the same for everybody. So it's not sort of putting out there and saying, just because this is how I experienced it, this is how other people should or could experience this. So I was first diagnosed with clinical depression about 4 years ago now. But I think probably on reflection, I had been experiencing symptoms and part of that for actually many years before that. And really, there were lots of barriers, I think, that stopped me from seeking help. But I think as part of that, self-stigma was definitely a huge had a huge role to play in why I didn't A, recognize it in myself, or then B, take those steps to kind of proactively address anything that I was feeling. And then more recently, I have experienced in the last 6 months quite a significant relapse in some of those symptoms alongside a sort of new diagnosis of anxiety as well. So I've been sort of muddling through that the last few months. And again, I think stigma has shown up for me, but in a slightly different way this time because I am at a different place in my career and I'm in a different role in what I do as well. So I think the first time for me, there was a real sense of failure and shame, I think, in admitting that I was struggling. And again, from my experience, for me, it was I am a perfectionist, and if I cannot simply cope with doing my job or living life or doing what I'm doing at that point in time, then that to me is a failure. So admitting that for whatever reason I wasn't coping and the symptoms that I was experiencing and the depression and everything that came as part of that for me, like I say, that was me admitting that I am not perfect. And that I think was really hard. That was that initial barrier. And I think it's really important at this point in time to say that actually education and learning about what self-stigma is was a huge part of what has helped me over the years in terms of coming to terms with the way I feel. And I think it's really important for us perhaps to just explain what self-stigma is, because self-stigma isn't, I think somebody else is going to judge me. It is your identity. It's that negative emotion that you build as part of yourself. It's not that I didn't sit there thinking, I think somebody else is going to think I'm a failure. I was a failure. That was who I was at that point in time. So it's not as simple as that self-awareness of thinking, oh, I think other people are going to judge me. Those negative emotions, they become part of who you are and how you deal with that situation. So for me, actually learning about that and learning the science behind that and having these conversations and doing some reading really helped me almost separate that and think, okay, actually, there is there is a scientific th this is a thing. There is, this is not me. I am not broken. I am not a failure. And it enabled me to take that part of sort of thinking about, okay, well, actually that's because society has taught me that, or because that's the way I grew up, or that's because how my environment as I lived in this experience taught me to feel that way. So I think education was a huge, huge thing for me. Having said that, then I have found this last sort of few months since I have become a coach that self-stigma has shown up in a really different way for me. So now I know what self-stigma is, and I know I teach other people how to build resilience skills. I work with people every day to support them. And then here I am experiencing my own challenges. So again, for me, yes, that sense of failure comes back in, but it's in a different way because it's like, well, I should be able to cope with this myself. I've got the skills. I know what I'm doing. I know on paper how to do this stuff, but here I am and I'm struggling. So again, it was that resistance of feeling like I couldn't or shouldn't ask for help because that would be a judgment on me and what I'm doing in my daily basis, my daily job, helping other people. Um, so I think that was a huge thing for me. So firstly, conversations like this, that education piece, that learning about what it is, what the barriers are, why that happens to us, and what that means for us, I think is a massive thing. I think the second thing for me was actually then once I had overcome that and actually had reached out for help and was going to coaching and counseling because I have had both in different ways over the years, um, learning sort of cognitive strategies or exercises to challenge my own self-beliefs. Because again, these are self-beliefs, they are part of you. Like I said, it's your identity. So you feel that wholeheartedly. But actually, if you can catch that feeling and you can catch that emotion and just learn to challenge that and say, actually, is that what is happening here? Yes, I feel that, but is that what is happening? That's a really powerful way of learning how to start overcoming as an individual some of those feelings. Um, and then I think finally for me, and this is a really big one, and again, this is different for everybody, but that piece around talking openly about your own struggles. And again, this is why I think today is part of my journey, because it can be very hard for some people to open up and talk, even to your closest friends, family, relatives, whoever, to your closest peer network about how you're feeling. It's even harder, I think, sometimes for some people to talk to your workplace about it, to talk to a wider population about it, and for me to come on and talk to however many people are listening out there about my own experience. But actually, what that provides for me personally is a sense of control and a bit of self-empowerment of actually I'm taking this back and I'm able to do this and I can talk about it and it's okay. And again, that's part of that journey of overcoming some of those negative self-beliefs about how I feel about myself. So yeah, hopefully that's helpful to somebody.
Yeah, thank you so much, Sophie. I really appreciate your vulnerability and sharing all of that and applaud you for standing up and having this conversation knowing that talking about it is going to help others. as well with their own journey. And you bring up a lot of great points, and I think the education piece is a big one, right? Having that understanding. We don't know what we don't know. So if we don't know what mental health challenges look like, or what options might be available to cope, then it's going to be hard to engage in that help seeking. And this is where I want to turn it over to Kathy, because Kathy, you have done such a tremendous job introducing programs like the Working Mind into our world of veterinary medicine here in Canada through the Canadian Vet Med Association. And it's really designed to open up these conversations and to educate, especially in the context of mental health in the workplace. How have you seen this program offer support for veterinary teams in practice in the context of mental health and help seeking?
Oh, well, may I just first say how grateful and appreciative I am to be on this panel and learning so much from Amanda. The stoplight, amazing. And Sophie, your open vulnerability and your self-awareness, deep reflection, incredible. It reminds me of what Malcolm Gladwell says about 10,000 hours to become competent. And I don't want to say an expert because I think that'll tap into our perfectionistic tendencies. Yet I think we give ourselves that grace and space, that mastering, overcoming self-stigma is developing that skill. So when I think about the Working Mind program, it really is intended to normalize conversations around mental health. And I think about the stoplight analogy that you used, Amanda, and that is the mental health continuum. You set me up so wonderfully to talk about it, that this continuum of mental health in the program helps us understand that we aren't mentally unwell or well. It's not a dichotomy or it's not a binary. Yes, I'm mentally well, and yes, I have, I'm living with a mental health disease. It really shows how mental health can fluctuate and be fluid across this continuum of green, healthy, into yellow, orange, reactive, injured, and then into red, which is ill. Across many domains, changes in mood and thinking, sort of to what you mentioned, Sophie, is shifting thinking and being aware of when our thinking patterns may shift, changes in mood and emotions, changes in physical, our own physical self, yet that might also show up in the workplace, that people notice changes in ourselves. Maybe we've gained weight, lost weight, we're looking disheveled, looking like we haven't slept. And then also changes in work behavior and performance. And the final domain that the mental health continuum taps into is changes in addictive behaviors, which may show up in changes in alcohol or substance use, amongst other addictive behaviors. And there's 80 indicators, at least in total, on this continuum. And I love that it gives us language to then have these open conversations with others in our workplace if we notice those changes in others, as well as being more self-aware of how we're showing up and shifting along the continuum. And let me reassure everyone that if one shifts along the continuum from healthy, feeling like you've got, good management or good control of your mood and emotions, and you're responding with empathy and care and curiosity, to impatience or frustration, that's a fluid shift. You can shift to the right and to the left along the continuum. So that continuum and the language framework that folks learn in the Working Mind, I've heard from participants say it helps them in the workplace notice with care and curiosity and kindness when there are indicators that that person is different than they usually are. And then to have that conversation with them. It's not nosy to have the conversation. And I can appreciate if one doesn't have a framework or how to approach that conversation, it can feel daunting and fearful and uncertain. And that's what I also appreciate about the framework that the Working Mind teaches, so that we can reach out and we can say, Marie, you don't seem like yourself today. Is everything okay? If you want to talk, I'm here for you. If you just want me to be with you or help you, even in your day to day, there might be some tasks that I can take off your plate to give you more coping capacity. And then likewise from the individual to be more aware of one's maybe changes in mood, changes in thinking patterns when you're getting into that self-doubt or the feelings of not having self-worthiness, is to say, okay, this is showing up in myself. Let me reach out and just start a conversation with someone. And it might be something like, there's a lot going on in my life today. I feel like I'm not focusing and concentrating well. I might need some help with these cases today. it's that shared reciprocity of both help asking, help giving. And then when we do receive help, and I've been in this situation where someone checked in with me and said, Kathy, you do not seem like yourself. I was really surprised how defensive I got. It was almost like I needed to say, well, I'm doing well. I'm doing okay, because I was worried that that person might lose trust in my ability to be competent. And this was in clinical practice, ability to be competent, that they think that I might make a mistake. Can they trust Kathy today because she seems off? Now I know to really give myself grace and space and know that that check-in comes from a place of care and curiosity and kindness, and to give the same to myself. And then finally, for managers, because the Working Mind has an employee course and a manager course, the manager course helps managers recognize those signs in the team members who would be reporting to them, and then have open conversations with them. Managers do have a duty to inquire. So when they notice changes, to have that conversation and to really shift the narrative from this might be a performance conversation to let's be present to the human being first, approaching with care and curiosity and kindness, and see what supports that person in the workplace would need before jumping to that performance sort of narrative. We might need to, the manager may need to, and it's not absolving accountability, it's just the timing. Let's approach the person first as a human being and offer support, and then have those performance conversations at the right time. So the Working Mind does provide that more team-based approach to looking at mental health and responding to mental health in the workplace. I look at it as sort of a trifecta of offering help, receiving help, asking for help. And then the final maybe public service announcement I'll make is that the Working Mind is becoming customized to veterinary medicine. It's a very strong evidence-based and practical course that the Mental Health Commission of Canada has developed and delivered, and we have delivered now for 3 years, and Maria, you're a facilitator in it. And how exciting we are that we have the funding from PetSecure to tailor the course to veterinary medicine and the unique stressors and protective factors that we have within our profession.
Yeah, it's such an exciting time, definitely for that mental health support in the veterinary profession, veterinary community, really here in Canada. And I want to go back to what you were sharing, Kathy, around supporting the team, that trifecta, right? It's supporting ourselves, looking to others, supporting the workplace in general. And I want to turn it back to Amanda, because you have so much experience in practice as a leader, helping leaders, guiding team members. Can you think of an example of a time when you saw a team member being supported through a mental health challenge and what the outcome was, not just for the individual, but for the team? Because I think sometimes we forget the ripple effect that one person's mental health challenge can have on the team, the patient care, the client's experience, etc.
I certainly have one story that comes straight to mind. And one, Sophie and Kathy, I think you set me up very well for this story because it really encompasses so much of what you said. Sophie, I really feel like shame is embedded in all of us in what we do. And it is the biggest barrier, and it has been for me. And we will tell anybody except for the people that we work with how we are, because we are just trying to, like, can't I get through this? Can't I push through? Shouldn't I know how to do this? Those are the stories that we tell ourselves all the time. And Kathy, you're so right that when you actually know your people, there are signs. There are signs that you're not okay. And we're bad about looking inward and having self-awareness of those signs for ourselves. And we could be better for our team members too, so that we're not waiting for things to get critical. But the story that comes to mind, and I'll paint this picture, I've had a unique experience of being able to be a full-time mentor to early career veterinarians for 3 years. So my sole purpose was supporting them. So I would go into their hospitals across the South in the US, and what I would do is spend the day with them, and they'd have my undivided attention. And it was just helping them develop as a doctor. So I was just kind of their buddy for the day. It might be surgeries, it might be cases, but there's one hospital that stands out that I went to. And this doctor was doing a fantastic job. It was an appointment day. We were busy. This is a 24/7 hospital. And out of all the hospitals I've been in, it was one of the best, most psychologically safe workplaces I've ever been in. And you could just feel it. Everyone is collaborating, talking to each other. Team members respect each other. They're checking in, and they're also practicing high quality standard of care. Patients get the best. Everybody wins. So this is the place. Leadership is incredible. And so this doctor is doing a wonderful job, communicating well with her clients, being very thorough with each patient. And as she's continuing to do a good job, she's like, I would really love a private meeting with you at lunch if we can. And I was like, of course, sure. So we step out and she just breaks down. And she's like, I just feel like I'm always failing, like I'm not enough, that I can't handle this career, that I don't belong here. And can I tell you that the managing doctor of this hospital is one of the best I've ever worked with and is one of the safest people that you could come to if you were struggling. And even though she knew that because she told me that, it was still in her workplace and she still didn't want anyone to know. I was just an outside mentor who didn't actually work in this hospital. And we had built some trust and she felt safe sharing this with me because she didn't have to save face. I wasn't actually in this hospital every day working with her. So what I did is one, validated her feelings. I don't think we do that enough as professionals. I certainly thought I had to have all the answers for way too long when I realized that that's not true. But then I really told her, these conversations with your leadership team, they can't wait to have it with you. They want to help make sure that you are fully supported, and I can validate you're doing a great job. So I role played with her to give her the confidence to sit down with her managing DVM and talk about it. So they put things in place so that they could have frequent check-ins to build her confidence. And I said, you need to be looking at the evidence of the great things that you're doing and occasionally speaking some positivity to yourself. We could all do that a little bit better. And so the managing doctor put more systems in place to have those frequent check-ins with the early career vets coming in and really everyone. So now it's just a better system. But otherwise, she probably would have never told a soul. So that really stands out for me.
Wow, that's incredible. And to imagine the ripple effect that that could have had, that these emotions could have built up over time. And because shame is so isolating, we feel like there's something wrong with us. So we don't want to tell anybody that, let alone the people we're working with. And it would have built up to the point where I know it was my experience when I was having mental health challenges when I was at the Ontario Vet College, is I ultimately resigned. Like I thought, I'm struggling. Everybody else looks fine. I don't feel like this is sustainable. I don't feel like I can do this long term. So I'm just gonna, give them 6 months notice and they can find somebody else for my job who clearly will know how to thrive when I feel like I'm barely surviving. So wonderful that you were able to normalize her experience, to validate her emotions, and to help the practice to set up those systems, those frequent check-ins, and everything else. Um, you know, Individuals may or may not find themselves in a place, even when they have a conversation with someone like you, Amanda, where they are ready to seek help. They might, despite your coaching, say, no way, I'm not telling this to anybody. And so that brings me to my next question for Sophie, which is, in your coaching experience, where do you feel like most people get stuck? Where is the hindrance to reaching out to a mentor, a supervisor, a coach, a mental health professional, and how do you help them get past those barriers?
Mm. I think that's a really challenging one actually, because I think oftentimes when people end up already at coaching, they have already overcome some barriers to a certain extent. But what I find is really interesting often in my experience with coaching and the people I work with is that people come to me for something quite specific. So that might be I'm having a difficult relationship in my workplace, or, I am feeling levels of stress that I want to learn some skills that I want to be able to cope with that stress at work. So they come for a very specific reason, but actually within coaching, we tend to build quite a close relationship and we dig into things over the course of that relationship that are related to why those experiencing their challenges, but not necessarily that person's initial reason for coming to you. And I think that's actually really powerful, because what we can sometimes do is uncover people's self-awareness about what's going on for them. And that's a huge thing that we've all spoken about. Both Amanda and Kathy have both raised that. I think having that level of self-awareness about what is going on for you is a really challenging thing. And for a lot of people, is we attribute how we're feeling to certain things. So during coaching, what I often find is we end up doing a little bit of a journey. And during that journey, we come across those barriers, and I might recognize something in somebody that I'm coaching that I start to think, there's something more going on for this person. Or, like Kathy said, there's those indicators, there's those things that you just get to know about somebody, that they show up in a slightly different way, or there's something that just tells you, okay, there's something that's underlying this. And we can work together to build that self-awareness for that person to then feel the confidence to be able to go and seek help in a different way should they need to do that, whether that's counseling privately or whether that is talking to the workplace, whatever that looks like for that individual. And I think that's really important in terms of helping not only gather that self-awareness, but then also learn how to have that confidence. And it's about normalizing those conversations. It's about learning who you are, what's going on for you at that moment in time, and that it is okay to go and speak to somebody else. So I would say, yeah, that lack of sort of self-recognition or self-awareness that there's something else going on for you at that time, that's really important to address. And then that helps with all of those things, because, right, we don't just show up to work or in any given day in isolation. All of these things are interconnected. So yeah, I think that's one of the biggest things, is just learning to recognize that in yourself.
Yeah, I feel like I'm having my own epiphany as I reflect back on my my own mental health challenges over the years. And like you said, you put it so nicely, where yeah, we're attributing it to one thing. I just need to be able to cope with the stress a little bit better. I need to be able to manage my time or meet my deadlines, or I need to be able to deal with this coworker that's just, that we keep butting heads. And there can be so much to unpack underneath that, and zero awareness or limited awareness whatsoever of what those underlying factors might be. You
Yeah.
also mentioned too, Sophie, that validation, and Amanda mentioned it, Kathy mentioned it. I want to go back to Kathy, because I think that there can be so much validation and safety in peer support. And I used to be very not critical, but skeptical, and cautious about peer support, because I felt like it could be dangerous. Like, we're not trained mental health professionals. Who are we to support a friend? And there's been actually good research to demonstrate in multiple spaces that peer support can be very, very helpful. And it can, in fact, improve mental health indicators like depression and post-traumatic stress when we feel validated and seen and held with compassion by those who really understand what we're going through. So, Kathy, you have great experience with Together All, which is another tool that the Canadian Vet Med Association introduced a few years ago. Can you tell us a little bit about that, and how that and maybe other initiatives can be helpful tools that organizations can use to support their members and people within our profession?
Absolutely. Together All is a really interesting peer program because it's digital. So it can be used 24/7, 365. There's clinical oversight by a licensed mental health professional. So to your point, Marie, that enables an element of safety so that if someone was, and trigger warning, if someone was to post something indicative of harm to self or harm to others, that licensed mental health person would be able to intervene and do a risk assessment and ensure that person is linked to local community resources to help keep that person safe. It's also completely confidential and anonymous. And I think back to what I mentioned, or what I heard Amanda mention about the EAP programs. I'm thinking sometimes a barrier to reaching out and getting help is my name will be taken, it will affect my license, my manager will know that I use this service. This Together All is it's confidential, it's safe, it's anonymous. It's also a very evidence-based system. It's been available for almost 10 years now. It's an organization in the UK that set it up. And when we first rolled it out, we rolled it out to veterinarians and student veterinarians with the help of our sponsor, Western Financial Group. Now, with the leadership of CVMA and ABVTA and our sponsor and the visionary approach of Together All, everyone in the Canadian vet profession has access to Together All. So that's nearly 50,000 incredible folks in the Canadian veterinary profession. And since it was opened up to the entire profession in the fall of 2025, what we're noticing is that nearly 69% of people, their activity on the Together All platform is occurring after hours. So that tells me maybe when traditional EAP programs aren't available, or maybe, I'm sure this doesn't happen to anyone, where you wake up at 2 a.m, you want to get something off your chest, you don't want to bother a peer or family member. This could provide that option to go on, write a talk about, and then hear back. And I heard both from Amanda and Sophie, that validating encouragement and acknowledgement of one's emotions and experience. So you really feel safe and supported. And also, where needed, those talkabouts could include some ways forward. Not advice, yet peers may say, well, if you want to hear my journey or my way that I navigated through, maybe it's looking after an ill elder, this is my experience. And then the other interesting thing about Together All is that about 65% of folks using it say that they don't have any other formal mental health support. And that could be they don't have access. So Together All can be a bridge in that respect because it is free, or they don't seek it. Sort of, Sophie, to your point, where are folks at in that change and awareness to trajectory in order to have the self-awareness to say, now I'm going to reach out. So Together All also might be a bit of a bridge towards, for instance, reaching out and talking to someone in more of a professional capacity. So that's the Together All as the peer platform. There's also other things on the peer platform, the Together All platform, like validated self-assessments and some really helpful educational tools. And then the other resource I'll speak to right now, because I think it's important, and I'm hearing this both from Amanda and Sophie, that sense of safety and validation and talking to someone who understands what we experience as veterinary professionals. We do have some really unique stressors in our profession. And that's one of the reasons CVMA started the Vet Connect directory. So this is a list of licensed mental health professionals, psychologists, psychotherapists, and social workers with deep experience in veterinary medicine. So what you're doing too, you come as a veterinary surgeon, you've got the added experience and skills of being a coach. These folks have experience either being veterinarians and RVTs, perhaps still practicing, as well as those who have deep experience in veterinary medicine. And that enables folks, when they get to that point of saying, yes, I'm ready to reach out and talk with a mental health professional, that they know they will be accepted in a safe way. They won't have to explain or even justify some of the things that we must do in veterinary medicine. And I'll add one more thing on to that. The Vet Connect directory is one of the psychologists on that directory says for many of our veterinary professionals who use her services, and this isn't the case for everyone because mental health is definitely a personal journey, yet cognitive reframing, like using cognitive behavioral therapy, has been really helpful. And I've heard that cognitive reframing a few times from Amanda and Sophie, sort of the shifting of thoughts, maybe from self-doubt to, I can see this in a different way, or what evidence do I have to let go of that self-doubt and look at maybe more positive coping strategies. Yet also, when we reach out to a licensed mental health professional or one who has credentials, it's a journey. It's trial and error. And I've been in that situation where talk therapy did not work for me, yet rapid eye movement desensitization does. And how the emotions I had when I was driving in my car to get the rapid eye movement, and I was excited about going to see a counselor, that was a huge shift in me. Yet I did need to go through that trial and error to try talk therapy. Didn't work. Yet I still had that gumption to continue to see if I could find a psychologist and psychotherapist to help me. So those would be the two resources that are available for anyone in the veterinary profession. Together All is free. And then the Vet Connect directory, these are licensed mental health professionals. So they would, there's payment obviously required for their services, yet all their phone numbers and their bio and their websites are on the CVMA webpage. Is it just for Canadians? Is that Together All or the Working Mind? I see that Sarah maybe asked a question. Together All, yeah, would be, well, the link to register is sort of open access. So I'm sure if anyone in the international veterinary profession went on to Together All, you're enabled to get in, right? They're not going to say, oh, someone's from the UK, we're not going to let them in. It's really the honor system. But we do promote it to the Canadian veterinary profession. And then the Vet Connect directory, anyone could use it. I mean, these folks, depending on their licensing, they might have a license for a particular province, which may enable them not to provide psychotherapy and social work, yet some of them might have a broader license.
Yeah, thank you so much, Kathy. To Sarah's question, I agree, Kathy. I think it depends on the mental health professional's licensing, and that's something that they'll be able to share with you. I think there is so much online therapy that happens now that many licensing bodies will allow individuals to have those relationships virtually with their clients, and that will be okay. So even if you're outside of Canada, I think it's worth looking into and seeing if you can find somebody who resonates with you. Because yeah, to your point, Kathy, it's very personal to find the right counselor, and it can take some time. And what I'm hearing from you in terms of organizational support is that it isn't just about providing EAP, and that there are barriers to using EAP for some folks. And Amanda highlighted a lot of ways that we can overcome those, but having opportunities for peer support, having educational initiatives, having just demonstrating in general that we feel as an organization that this is important and we want to support our members. And that leads me into the question that I want to ask Amanda next. Because I do think that there is a responsibility for everyone. There's the individual responsibility, there's hopefully the organizational, the high level responsibility. And Amanda, your experience is predominantly working with leaders. And you mentioned a term previously, psychological safety. And I think we need to unpack that just a little bit here, because I want to know for you, what advice do you give to leaders and mentors and managers who want to foster that culture that it is safe to ask for help, but they don't know where to start? A lot of the times, for example, when I'm facilitating the Working Mind, that's the biggest fear of managers is, I don't want to make it worse. I don't know what to say. Isn't that too private? How do you help them through that? And what strategies do you offer?
It's so important, Marie. And I think it's okay to give ourselves permission as leaders to flail a little bit until we can find a rhythm of what is comfortable with our workplace. But the answer will always be to spend more intentional time with your people. And I don't know of a crazier job than a veterinarian leading a hospital team. You're the doctor, which that alone consumes you. So doing anything else for your team is overwhelming. So time is hard to come by, right? So that intentional time has to address what's uncomfortable, but it's got to be a safe space. So building trust takes time, right? And that has to happen for any individual to move past these giant barriers of shame, feeling like it's weak if I come to you with an issue and that I should just understand what I need to do and be fine. So in order to move past that, just asking questions like, how are things feeling for you right now? Just practice that. And also know that not everyone's comfortable with just sitting face to face. It's very intimidating and scary for a lot of us. And you may have to think about an asynchronous communication approach. So maybe it's an email that someone can just respond at home when they're, not in front of you. Maybe it's getting, some surveys out to your team where it's anonymous and just asking if there's, how are we feeling at work? Is there one thing that could really help improve the well-being in your day, in the workplace? What is that? So getting some feedback from your team, that's really difficult to do, especially if you're asking the question, like, how could I be a safer space for you to bring any issues to, but those are things that we need to hear from our team. But building trust is key. And so tips for that would be, that was really challenging when I was a full-time mentor to doctors that I only saw a few times without the year. So I had to really make sure that we had a strong foundation, that you knew that I see you as a person. And so that's what leaders really need to focus on, is that this team member in front of you needs to feel seen and recognized and truly appreciated, and that you just see them as a person first and an employee second. And when they bring information to you, that's sacred, that is confidential, and it should always be kept that way. And when there's something that they bring to your attention that really does need to be addressed, address it. Don't let it go. And I know that we're busy, and if time, passes and you don't get to it, follow up and say when it will be addressed. So maybe you're changing the workflow, addressing something with a team member, or maybe you're helping them develop in an area where they feel really uncomfortable, right? Anesthesia, like having any team member there who doesn't feel properly trained, that affects your well-being and your mental health. So what can you do as a leader? Give options and just start by addressing what's uncomfortable in a kind way, and don't give up. Keep trying, because, we're all going through something, and it just takes a little bit of patience sometimes.
Ah, such great recommendations. I'm like soaking it in. I'm like, man, this is, I'm gonna remember this for the next time I'm in the ICU and working with potentially a new team, right? Where you are trying to build that trust, where they don't maybe know you. And yeah, it's such a foundational piece. And as you said earlier, and as Kathy alluded to as well, you need to have that baseline foundational awareness of your teams as whole human beings, so that you can pick up on those little things that demonstrate that maybe their mental health is not in the green, right? And so I love that. Great, great words of wisdom. Sophie, what thoughts do you have to share around how coaching or mentorship with veterinary professionals can help them with their own well-being and really maintaining their purpose in this really high stress career? What are some things that you might want to mention there?
I just really want to pick up on what you've both just said about that human piece, and I think that really segues in nicely to exactly what coaching is all about. Coaching is such a deeply personal experience for every individual, and it is, when you work with a coach, you can trust that you are working with somebody who's got your back, right? That they are there for you and you only, and it's your experience, and they genuinely care about working with you to support you, to give you the tools to work through that. And that's that humanity piece that Amanda and yourself just picked up on. That it's like, as people, when we go to work, we aren't just what we do at work. We are still everything we are as human beings, and we bring everything, that all of the messy stuff, all of the great stuff that shows up for us at work. And it's actually recognizing that and honoring that and working out how to celebrate that, I guess. So for me, I think the benefits of coaching really come from, firstly, that it's that personalized human experience, being able to work one-on-one with somebody where you can build that level of trust, and where with your coach sort of relationship you build together, and you really start to learn that there are things that you can talk about, and you build that level of trust. Often in the coaching relationship, there are lots of different things that we'll work on, and it depends on what that person brings to you. But always there tends to be some element of coming back to understanding our why. what are we doing this for? Why do we go to work? What did we get into the veterinary profession for? Why did we love it back then? Why are we perhaps not loving it right now? And what can we do to sort of recreate some of that passion for why we were doing that? And that comes back to understanding our values. And values are what drive us in our everyday life. They are what we believe in. They are part of who we are, part of our identity. So working with a coach to help you recognize those values, to identify them, and then a coach can also help you to learn how to bring that back into your daily life. Perhaps you are in a position at work where you have strayed outside of doing something that speaks directly to your values, but are there other things that we can do to bring that back for you? So a coach can help you sort of implement those changes to your career, to your daily living, how you show up every day to make sure that you are living aligned with your values. A coach can also help you integrate new habits. They can support you with learning how to build those skills to deal with stress or to deal with whatever it is that you are experiencing. And like I say, it's that really deeply personalized journey, and it changes as you go along as well. You might, as we said before, you might go to a coach for one specific thing, and actually that those little threads, those little sort of spider webs, it pulls out something else, and then it's like, oh, okay, yeah, let's tease at that a little bit and let's see if I can move forwards with that. So I just think from my experience being coached myself for many years and also being a coach, I think it is something that can just have a world of benefits in that personalized experience for sure.
Yeah, so much great stuff there. You've covered very well, like what individuals can do if they're looking for some resources to support their mental well-being and their resilience. And Amanda, you highlighted the leadership piece within the practice. Kathy, I want to turn it over to you for last thoughts on what organizations can do. You've mentioned all the things that the Canadian Vet Med Association is doing with Together All, the Working Mind, Vet Connect. How can organizations really strive to create an environment that actively supports veterinary professionals' mental health?
Thanks. And I'm going right back to something, Amanda, you said at the very beginning, which is leaders set the tone. So I think about leaders being open and vulnerable and open-hearted in their own mental health journey. It might be stress, it may be burnout, maybe it's something like you, Marie, you've been very open in talking about the impact of making a mistake. And then in a recovery-based way, a recovery-based story. And a tool that managers, leaders may find helpful is the Mental Health Commission of Canada guidelines for recovery-oriented practice. I'll make sure that you get that link, Marie, and then send it out tomorrow. So that's, and to embed conversations around mental health in the day-to-day. So maybe it's team meetings, maybe it's rounds, M&Ms, mortality, morbidity rounds, so that it almost becomes part of breathing. That mental health is just something, and being aware of the indicators on the working mind, just part of the day-to-day. I think another thought is the resources and that recovery, and like really cultivating that sense of recovery and rest within the practice, which can also include practical ways to support that. I would love to see as many workplaces in Canada offer paid sick leave. And again, not stigmatize it, because that's the value of the grace and space we need to recover to come back to work and be fully productive. The other thought I have is for teams, if they're uncertain about reaching out and accessing a resource, and I think about 988. So we can get these stickers from 988 for free. Both, and 988 it would be the crisis line, both in Canada and the United States, and you get posters as well, right? So and everyone knows their clinic best, have the posters, have the stickers of the EAP or the 988 or other resources throughout the clinic, provide them digitally, so that in those moments where people are having those self-doubts, they'll look around and say, there are people who want to hear my story and who will support me with safety, and to know that it takes a lot of strength and courage to reach out. Yet mental health isn't a solo job. And I think this is a new way of looking at it in veterinary medicine. It's a team effort. So that would be the other thought I have, is make those resources as visible, easy to access, and even like with 988, call together as a team. And I know teams who have done that, so that when you're in a situation where a client may be in crisis, or one of your colleagues, or even a family member, you know what it feels like to call. How does it feel for someone to pick up the phone on 988? What does that volunteer say? When might they triage you to one of their paid staff members who are often social workers or mental health professionals? That takes away the fear and the uncertainty and lowers the barrier then to access those resources.
I love that, Kathy. What a great note to end on. Thank you so much for sharing those resources. And I've popped a bunch of links in the chat, but we will make sure that everybody gets a copy of that via email if you've registered. If you're watching this on YouTube, then we will include all of this in the description below the video. I do want to give us all an opportunity in the spirit of Bell Let's Talk Day and the theme this year to highlight one small but meaningful action or moment that each of you takes to support your own mental health, even on a busy day. And I'll start by sharing it is getting very cold again here this week in Edmonton, and I still make a point of getting out with my dog every single day. I need that fresh air. I cannot be inside all day. Going to and from my daughter's school to pick her up is not enough. I need to be outside in the expansive open. So that is one thing that I do. Amanda, how about you?
Yeah, for me, there's a lot of tools that I have found have been helpful, but I couldn't use them if I didn't first start practicing self-awareness and know when I need them. And I was terrible at that. I was just like many of us who push through, and before you know it, I'd be very sick on the other side. So practicing some self-awareness of when I'm feeling my heart racing and I get this tightening behind my shoulders. I get a lot of neck and shoulder strain. And so when that's happening, I'm very aware of it now that I need to do something to help myself. And number one, because I can use this on a busy day in any environment, is box breathing. I'm sure many have heard of it. I heard of it from Brene Brown, but it's just a 4-second count where you breathe in, hold your breath, breathe out, and hold your breath. And you're supposed to do it for 5 to 10 cycles. And so on a busy work day, or even if I dropped a pedicle during a spay and my heart is racing, I could do it anywhere and my heart rate would come down. I'd always have more oxygen, better mental clarity, and it made such a difference. And it's so easy to do. So, highly recommend.
Love it. Sophie, what about you?
Yeah, one of the things I try and do every day, even I guess if I'm particularly stressed at work and we're all in our own heads and we're just busy, heads down, getting on with things, is and it's going back to that human connection piece. It is give somebody a compliment, or yeah, just sort of take 5 minutes just to speak to somebody about something outside of what's going on for them. Ask them how their weekend was, or something so simple as that, because giving somebody a compliment or having that human, it builds that human connection. It takes your head outside of what is stressing you out at that particular moment, particularly if it's a busy day at work. But also it makes us feel good to make other people feel good, right? So it's actually quite a selfish thing, but that's fine. So yeah, helps me to see other people smile and make other people feel good.
I love that. Kathy?
This is such a beautiful question. I'm smiling as I think about it and getting butterflies as I share my answer, which is similar to yours, Marie. It's getting outside, going to the barn every single day to see my horse, Flora, kiss her soft muzzle, hang out with my stable friends. At night, see the stars overhead, hear the calls of the ravens. Like ravens have the most interesting articulating chatter. And it's truly my third space and really an incredible community, both of people and animals, to keep myself grounded. And Sophie, to your point, I believe it really releases a lot of oxytocin and positive neurotransmitters in myself to others. So I have them, I give them, I receive them. And I always go away feeling really revitalized, except when Flora has a hoof abscess. And then she's a stressor in my life. But most of the time, her hooves are amazing and her muzzle is very soft.
I love it. Kathleen shared in the chat as well. Walk my dogs every day and puzzle. Yeah. So we all have these little sprinkled moments, and that is the whole point of our conversation today, is to really talk more about that, open up the conversation, I encourage you to share this within your teams as well. So thank you again so much to our panelists. I've got some wrap up items that I want to share as well. I'm just going to share my screen, my PowerPoint slide once again here, because I do want to acknowledge the work that Sophie does as one of our coaches. If anybody is interested in learning more about coaching through Reviving Veterinary Medicine, please do take a look at that. Once again, I want to thank each and every one of our panelists for sharing their expertise, insights, and real world experiences. This has been so very helpful. We recognize that seeking help for mental health as veterinary professionals can feel very challenging. And so we hope that you leave today with these concrete tools and strategies that we've talked about and ideas for normalizing help seeking within your practices and within your teams. If you do have any lingering questions, the recording will be available on YouTube, so you can go back and visit that anytime. You can reach out to any of us anytime. We'll have our contact information available as well. And if you're looking for additional evidence-based resources and tools for promoting mental health and well-being among veterinary professionals, please do visit revivingvetmed.com, where you can find free downloads, blog posts, podcast episodes, meditations, you name it, many different supports there as well. And of course, as Jamie has shared in the chat, you can email us at info@revivingvetmed.com if you have any further questions or if you need more individualized support for your team. So thank you everybody for joining, for your engagement, for prioritizing well-being in the work that you do. We really do appreciate you being here and building and nurturing our community with us. And we look forward to everybody continuing this conversation in their own clinics and communities. So thank you so much, everybody. Have a wonderful rest of your day.